NCLEX RN Test Bank for 2026 Part 1. Question 1. A client with ascites is scheduled for a paracentesis. Which instruction should be given to the client before the procedure? Here are the options. Option A. You will need to lay flat during the procedure. Option B. You need to empty your bladder before the procedure. Option C. You will be asleep during the procedure. Option D. The doctor will inject a medication during the procedure. The correct answer is option B. You need to empty your bladder before the procedure. Correct answer. You need to empty your bladder before the procedure. Question 2. A client's lab values reveal Hgb 12.6, WBC 6500 Q.mm, K plus 1.9, uric acid 7.0, Na plus 136, and platelets 178,000 Q.mm. The nurse evaluates that the client is experiencing which of the following? Hypernatremia, hypokalemia, myelosuppression, leukopenia. Here are the options. Option A. Hypokalemia. The correct answer is option A. Hypokalemia. Correct answer. Hypokalemia. Question 3. The nurse is caring for the client who has been in a coma for 2 months. He has signed a donor card, but the wife is opposed to the idea of organ donation. How should the nurse handle the topic of organ donation with the wife? Here are the options. Option A. Tell the wife that the hospital will honor her wishes regarding organ donation, but contact the organ retrieval staff. Option B. Tell her that because her husband signed a donor card, the hospital has the right to take the organs upon the death of her husband. Option C. Explain that it is necessary for her to donate her husband's organs because he signed the permit. Option D. Refrain from talking about the subject until after the death of her husband. The correct answer is option A. Tell the wife that the hospital will honor her wishes regarding organ donation, but contact the organ retrieval staff. Correct answer. Tell the wife that the hospital will honor her wishes regarding organ donation, but contact the organ retrieval staff. Question 4. Due to a high census, it has been necessary for a number of clients to be transferred to other units within the hospital. Which client should be transferred to the postpartum unit? Here are the options. Option A. A 66-year-old female with gastroenteritis. Option B. A 40-year-old female with a hysterectomy. Option C. A 27-year-old male with severe depression. Option D. A 28-year-old male with ulcerative colitis. The correct answer is option B. A 40-year-old female with a hysterectomy. Correct answer. A 40-year-old female with a hysterectomy. Question 5. Before administering theodorophyllene, the nurse should check the patients. Here are the options. Option output. Option B. Blood pressure. Option C. Pulse. Option D. Temperature. The correct answer is option C. Pulse. Correct answer, pulse. Question 6. Which information should be given to the patient undergoing radiation therapy for breast cancer? Here are the options. Option A. Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. Option B. Moisturize the radiation site with oil-based lotion to prevent blistering. Option C. Use bath oil when tub bathing to prevent drying and peeling. Option D. Report redness and soreness of the area to the physician. The correct answer is option A. Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. Correct answer. Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. Question 7. The charge nurse is making assignments for the day. After accepting the assignment to care for a client with leukemia, the nurse tells the charge nurse that her child has chickenpox. Which initial action should the charge nurse take? Here are the options. Option A. Change the nurse's assignment to another client. Option B. Explain to the nurse that there is no risk to the client. Option C. Ask the nurse if the chickenpox have crusted. Option D. Ask the nurse if she has ever had the chickenpox. The correct answer is option D. Ask the nurse if she has ever had the chickenpox. Correct answer. Ask the nurse if she has ever had the chickenpox. Question 8. Which statement is true regarding therapy with Levemir insulin detemir? Here are the options. Option A. The onset is 1-2 hours. Option B. It may be mixed with regular insulin. Option C. It peaks in 2-3 hours. Option D. The duration is 24 hours. The correct answer is option D. The duration is 24 hours. Correct answer. The duration is 24 hours. Question 9. Which client should be assigned to the nursing assistant? Here are the options. Option A. The 18-year-old with a fracture to 2 cervical vertebrae. Option B. The infant with meningitis with a temperature of 101 degrees F. Option C. The elderly client with a thyroidectomy 4 days ago. Option D. The client with a thoracotomy 2 days ago. The correct answer is option C. The elderly client with a thyroidectomy 4 days ago. Correct answer. The elderly client with a thyroidectomy 4 days ago. Question 10. The physician has ordered the Schilling test for a patient with suspected pernicious anemia. What other vitamin level is often assessed at the same time as the B12 level? Here are the options. Option A. Folic acid. Option B. Pyridoxine. Option C. Ascorbic acid. Option D. Thiamine. The correct answer is option A. Folic acid. Correct answer. Folic acid. Question 11. The client is admitted to the emergency room with shortness of breath, anxiety, and tachycardia. His ECG reveals atrial fibrillation with a ventricular response rate of 130 beats per minute. The doctor orders quinidine sulfate. While he is receiving quinidine, the nurse should monitor his ECG for. Here are the options. Option A. Peaked P wave. Option B. Elevated ST segment. Option C. Inverted T wave. Option D. Prolonged QT interval. The correct answer is option D. Prolonged QT interval. Correct answer. Prolonged QT interval. Quinidine can cause widened QT intervals and heart block. Question 12. A 25-year-old client arrives in the emergency room with a possible fracture of the right femur. The nurse should anticipate an order for. Here are the options. Option A. Bryant's traction. Option B. ice to the entire extremity. Option C, buccal traction. Option D, an abduction pillow. The correct answer is option C, buccal traction. Correct answer, buccal traction. Question 13. Which statement should be included in the teaching session of a client scheduled for a renal biopsy? Here are the options. Option A, you will be placed in a sitting position for the biopsy. Option B, you may experience a feeling of pressure or discomfort during aspiration of the biopsy. Option C, you will be asleep during the procedure. Option D, you will not be able to drink fluids for 24 hours following the study. The correct answer is option B. You may experience a feeling of pressure or discomfort during aspiration of the biopsy. Correct answer. You may experience a feeling of pressure or discomfort during aspiration of the biopsy. Question 14. The client is admitted with chronic obstructive pulmonary disease. Blood gases reveal pH 7.36, Co245, O284, bicarb 28. The nurse would assess the client to be in. Here are the options. Option A, uncompensated acidosis. Option B, compensated alkalosis. Option C, compensated metabolic acidosis. Option D, uncompensated metabolic acidosis. The correct answer is option C, compensated metabolic acidosis. Correct answer, compensated metabolic acidosis. Question 15. Before administering intravenous chemotherapy to the patient being treated, the nurse should. Here are the options. Option A, administer a bolus of Roman 4 fluid. Option B, administer pain medication. Option C, administer an antiemetic. Option D, allow the patient a chance to eat. The correct answer is option C, administer an antiemetic. Correct answer, administer an antiemetic. Question 16. Which one of the following statements is correct when measuring the client for crutches? Here are the options. Option A, a distance of 5 finger breadths should exist between the top of the crutch and the axilla. Option B, the nurse should measure 3 inches between the top of the crutch and the axilla. Option C, the client's elbow should be flexed at a 10 degrees angle. Option D, the crutches should be extended 8 to 10 inches from the side of the foot. The correct answer is option B. The nurse should measure 3 inches between the top of the crutch and the axilla. Correct answer. The nurse should measure 3 inches between the top of the crutch and the axilla. Question 17. A patient of Greek descent has been prescribed Bactrim sulfamethoxazotrimethoprim for treatment of a urinary tract infection. Before beginning the medication, the patient should be assessed for which of the following disorders? A D6PD deficiency, beta-thalassemia, sickle cell anemia, von Willebrand disease. Here are the options. Option A, G6PD deficiency. The correct answer is option A, G6PD deficiency. Correct answer, G6PD deficiency. Question 18. The physician has ordered Coumadin sodium warfarin for a client with thrombophlebitis. The order should be entered to administer the medication at. Here are the options. Option A, 0.9 Option B, 1,200. Option C, 1,700. Option D, 2,100. The correct answer is option C, 1,700. Correct answer, 1,700. Question 19. The nurse is caring for a client with cerebral palsy. The nurse should provide frequent rest periods because here are the options. Option A. Grimacing and writhing movements decrease with relaxation and rest. Option B. Hypoactive deep tendon reflexes become more active with rest. Option C. Stretch reflexes are increased with rest. Option D. Fine motor movements are improved by rest. The correct answer is option A. Grimacing and writhing movements decrease with relaxation and rest. Correct answer. Grimacing and writhing movements decrease with relaxation and rest. Question 20. The nurse is assisting in the care of a patient who is 2 days post-operative from a hemorrhoidectomy. The nurse would be correct in instructing the patient to. Here are the options. Option A. Avoid a high-fiber diet. Option B. Continue to apply ice packs. Option C. Take a laxative daily to prevent constipation. Option D. Use a sitz bath after each bowel movement. The correct answer is option D. Use a sitz bath after each bowel movement. Correct answer. Use a sitz bath after each bowel movement. Question 21. A client with an abdominal aortic aneurysm is admitted in preparation for surgery. Which finding should be reported to the doctor? Here are the options. Option A. A WBC of 14, zvp. Option B. Auscultation of abdominal brute. Option C. Complaints of lower back pain. Option D. A platelet count of 175. The correct answer is option A. A WBC of 14. Correct answer. A WBC of 14. Question 22. The nurse is performing an assessment on a client with possible pernicious anemia. Which finding is specific to pernicious anemia? Here are the options. Option A. A weight loss of 10 pounds in 6 months. Option B. Fatigue. Option C. Glossitis. Option D. Pallor. The correct answer is option C. Glossitis. Correct answer. Glossitis. Question 23. The nurse is making assignments for the day. The staff consists of an RN, an LPN, and a nursing assistant. Which client could the nursing assistant care for? Here are the options. Option A. A client with Alzheimer's disease. Option B. A client with pneumonia. Option C. A client with cirrhosis. Option D. A client with thrombophlebitis. The correct answer is option A. A client with Alzheimer's disease. Correct answer. A client with Alzheimer's disease. Question 24. The client is diagnosed with multiple myeloma. The doctor has ordered cyclophosphamide Cytoxan. Which instruction should be given to the client? Here are the options. Option A. Walk about a mile a day to prevent calcium loss. Option B. Increase the fiber in your diet. Option C. Report nausea to the doctor immediately. Option D. Drink at least 8 large glasses of water a day. The correct answer is option D. Drink at least 8 large glasses of water a day. Correct answer. Drink at least 8 large glasses of water a day. Question 25. While caring for an elderly patient with hypertension, the nurse notes the following vital signs: BP of 140/40, pulse 120, respirations 36. The nurse's initial action should be to. Here are the options. Option A. Report the findings to the physician. Option B. Recheck the vital signs in 1 hour. Option C. Ask the patient if he's in pain. Option D. Compare the current vital signs with those on admission. The correct answer is option A. Report the findings to the physician. Correct answer. Report the findings to the physician. Question 26. The charge nurse overhears the patient care assistant speaking harshly to the client with dementia. The charge nurse should. Here are the options. Option A. Change the nursing assistant's assignment. Option B. Explore the interaction with the nursing assistant. Option C. Discuss the matter with the client's family. Option D. Initiate a group session with the nursing assistant. The correct answer is option B. Explore the interaction with the nursing assistant. Correct answer. Explore the interaction with the nursing assistant. Question 27. Which action by the home health nurse indicates a knowledge of the needs of an elderly client? Here are the options. Option A. Teaching regarding availability and services offered by hospice care. Option B. Speaking in a higher-pitched voice tone to facilitate hearing. Option C. Encouraging fluid restriction to prevent nighttime voiding. Option D. Reinforcing teaching regarding the prevention of falls. The correct answer is option D. Reinforcing teaching regarding the prevention of falls. Correct answer. Reinforcing teaching regarding the prevention of falls. Question 28. A client with glomerulonephritis is placed on a low-sodium diet. Which of the following snacks is suitable for the client with sodium restriction? Peanut butter cookies, grilled cheese sandwich, cottage cheese, and fruit fresh peach. Here are the options. Option A. Fresh peach. The correct answer is option A. Fresh peach. Correct answer. Fresh peach. Question 29. The nurse can help alleviate the discomfort the client is experiencing associated with xerostomia by limiting fluid intake, administering an analgesic, splinting swollen joints, providing sugarless hard candy. Here are the options. Option A. Providing sugarless hard candy dry mouth. The correct answer is option A. Providing sugarless hard candy dry mouth. Correct answer. Providing sugarless hard candy dry mouth. Question 30. The client returns to the recovery room following repair of an abdominal aneurysm. Which finding would require further investigation? Vital pulses, regular urinary output 20 ml in the past hour, blood pressure 108/50, oxygen saturation 97%. Here are the options. Option A. Urinary output 20 ml in the past hour. The correct answer is option A. Urinary output 20 ml in the past hour. Correct answer. Urinary output 20 ml in the past hour. Question 31. The nurse has an order for the administration of intravenous heparin. The medication should be administered using a /n metered chamber infusion controller intravenous filter 3-way stopcock. Here are the options. Option A. Infusion controller. The correct answer is option A. Infusion controller. Correct answer. Infusion controller. Question 32. A patient is diagnosed with secondary syphilis. The nurse can expect the patient to have copper penny rash on the palms of the hands and soles of the feet, localized tumors in the skin, bones, and liver, chancres, and lymphadenopathy, general paresis. Here are the options. Option A. Copper penny rash on the palms of the hands and soles of the feet. The correct answer is option A. Copper penny rash on the palms of the hands and soles of the feet. Correct answer. Copper penny rash on the palms of the hands and soles of the feet. Question 33. The nurse is assessing the abdomen. The nurse knows the best sequence to perform the assessment is inspection, auscultation, palpation, auscultation, palpation, inspection, palpation, inspection, auscultation, inspection, palpation, auscultation. Here are the options. Option A. Inspection, auscultation, palpation. The correct answer is option A. Inspection, auscultation, palpation. Correct answer. Inspection, auscultation, palpation. Question 34. A client is scheduled for surgery in the morning. Which of the following is the primary preoperative responsibility of the nurse? Making sure the vital signs are recorded, obtaining a signed permit for surgery, explaining the surgical procedure, answering questions about the surgery. Here are the options. Option A. Making sure the vital signs are recorded. The correct answer is option A. Making sure the vital signs are recorded. Correct answer. Making sure the vital signs are recorded. Question 35. A 70-year-old male who is recovering from a stroke exhibits signs of unilateral neglect. Which behavior is suggestive of unilateral neglect? The client is observed shaving only one side of his face. The client is unable to complete a range of vision without turning his head side to side. The client is unable to carry out cognitive and motor activity at the same time. Here are the options. Option A. The client is observed shaving only one side of his face. The correct answer is option A. The client is observed shaving only one side of his face. Correct answer. The client is observed shaving only one side of his face. Question 36. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roughage diet. Which food would have to be eliminated from this client's diet? Roasted chicken noodles, cooked broccoli, custard. Here are the options. Option A. Cooked broccoli. The correct answer is option A. Cooked broccoli. Correct answer. Cooked broccoli. Question 37. The doctor orders 2% nitroglycerin ointment in a 1-inch dose every 12 hours. Proper application of nitroglycerin ointment includes rotating application sites, limiting applications to the chest, rubbing it into the skin, covering it with a gauze dressing. Here are the options. Option A. Rotating application sites. The correct answer is option A. Rotating application sites. Correct answer. Rotating application sites. Question 38. The client has an order for fesol ferrous sulfate. To promote absorption, the nurse should administer the medication with milk, meal, orange juice, undiluted. Here are the options. Option A. Orange juice. The correct answer is option A. Orange juice. Correct answer. Orange juice. Question 39. Which information should be given to the client using a TENS unit? Electrocution may occur if you use water with this unit. Skin irritation may occur with prolonged use of the unit. The unit can be placed anywhere on the body without fear of adverse reactions. A cream or lotion should be applied to the skin before applying the unit. Here are the options. Option A. Skin irritation may occur with prolonged use of the unit. The correct answer is option A. Skin irritation may occur with prolonged use of the unit. Correct answer. Skin irritation may occur with prolonged use of the unit. Question 40. The nurse is making initial rounds on a client with a C5 fracture stabilized by Crutchfield tongs. Which equipment should be kept at the bedside? Forceps, torque wrench, wire cutters, screwdriver. Here are the options. Option A. Torque wrench. The correct answer is option A. Torque wrench. Correct answer. Torque wrench. Question 41. The client with diabetes is preparing for discharge. During discharge teaching, the nurse assesses the client's ability to care for himself. Which statement made by the client would indicate a need for follow-up after discharge? I live by myself. I have trouble seeing. I have a cat in the house with me. I usually drive myself to the doctor. Here are the options. Option A. I have trouble seeing. The correct answer is option A. I have trouble seeing. Correct answer. I have trouble seeing. Question 42. Which of the following post-operative diets is appropriate for the client who has had a hemorrhoidectomy? High-fiber lactose-free bland clear liquid. Here are the options. Option A. Lear liquid. The correct answer is option A. Lear liquid. Correct answer. Lear liquid. Question 43. The nurse is assessing the vital signs of a client with pancreatic cancer. In addition to routine vital signs, the nurse assesses the fifth vital sign of anorexia, pain, insomnia, fatigue. Here are the options. Option A. Pain. The correct answer is option A. Pain. Correct answer. Pain. Question 44. A home health nurse is planning for her daily visits. Which client should the home health nurse visit first? A client with AIDS being treated with Foscavir Foscarnet, a client with a fractured femur in a long leg cast, a client with a recent laryngectomy for laryngeal cancer, a client with diabetic ulcers to the left foot. Here are the options. Option A. Laryngectomy for laryngeal cancer. The correct answer is option A. Laryngectomy for laryngeal cancer. Correct answer. Laryngectomy for laryngeal cancer. Question 45. The nurse is removing a peripherally inserted central catheter PICC. The nurse should position the patient in which position? Fowler's right side lying, left side lying, Trendelenburg. Here are the options. Option A. Trendelenburg. The correct answer is option A. Trendelenburg. Correct answer. Trendelenburg. Question 46. The nurse is assigning staff for the day. Which client should be assigned to the nursing assistant? A 5-month-old with bronchiolitis, a 10-year-old who is 2-day post-appendectomy, a 2-year-old with periorbital cellulitis, a 1-year-old with a fractured tibia. Here are the options. Option A. A 10-year-old who is 2-day post-appendectomy. The correct answer is option A. A 10-year-old who is 2-day post-appendectomy. Correct answer. A 10-year-old who is 2-day post-appendectomy. Question 47. Which of the following is a late sign associated with oral cancer? Warmth, odor, pain, ulcer with flat edges. Here are the options. Option A. Pain. The correct answer is option A. Pain. Correct answer, pain. Question 48. A client with an ileostomy is being discharged. Which teaching should be included in the plan of care? Using Carrea powder to seal the bag. Irrigating the ileostomy daily. Using stomadhesive as a skin protector, using a stool softener as needed. Here are the options. Option A. Using stomadhesive as a skin protector. The correct answer is option A. Using stomadhesive as a skin protector. Correct answer. Using stomadhesive as a skin protector. Question 49. The nurse discovers a patient care assistant looking through the client's belongings while the client is out of the room. Which action should be taken by the nurse? Discuss the nursing assistant's behavior with the family. Report the incident to the charge nurse. Monitor the situation and note whether any items are missing. Ignore the situation until items are reported missing. Here are the options. Option A. Report the incident to the charge nurse. The correct answer is option A. Report the incident to the charge nurse. Correct answer. Report the incident to the charge nurse. Question 50. The physician has prescribed Civox linezolid for a patient with VRE. The concurrent use of which of medication may result in serotonin syndrome? Nexium, esomeprazole, Zoloft, sertraline, Lipitor, atorvastatin, Zyrtec, cetirizine. Here are the options. Option A. Zoloft, sertraline. The correct answer is option A. Zoloft, sertraline. Correct answer. Zoloft, sertraline. Question 51. The doctor has ordered antithrombotic stockings to be applied to the legs of a client with peripheral vascular disease. The nurse knows antithrombotic stockings should be applied before the client arises in the morning, with the client in a standing position after the client has bathed, and applied lotion to the legs before the client retires in the evening. Here are the options. Option A. Before the client arises in the morning. The correct answer is option A. Before the client arises in the morning. Correct answer. Before the client arises in the morning. Question 52. The nurse's planning room assignment for the day. Which client should be assigned to a private room if only one is available? The client with Cushing's disease, the client with diabetes, the client with acromegaly, the client with myxedema. Here are the options. Option A. The client with Cushing's disease condition makes him more susceptible to infection. The correct answer is option A. The client with Cushing's disease condition makes him more susceptible to infection. Correct answer. The client with Cushing's disease condition makes him more susceptible to infection. Question 53. The physician has ordered atropine sulfate 0.4 mg IM before surgery. The medication is supplied in 0.8 mg per milliliter. How much medication should the nurse prepare to administer? 0.25 ml, 0.5 ml, 1.0 ml, 1.25 ml. Here are the options. Option A. 0.5 ml. The correct answer is option A, 0.5 ml. Correct answer, 0.5 ml. Question 54. A client is scheduled to have a cardiac CTA with contrast. Before the procedure, the nurse should assess the patient for allergies to shellfish or iodine, allergies, the ability to lie prone for 30 minutes, a history of reaction to nitrates, the presence of body tattoos. Here are the options. Option A, allergies to shellfish or iodine allergies. The correct answer is option A, allergies to shellfish or iodine allergies. Correct answer, allergies to shellfish or iodine allergies. Question 55. Which statement made by the student nurse indicates the need for further teaching regarding the administration of heparin? I will administer the medication 1-2 inches away from the umbilicus. I will not massage the injection site after administering the heparin. I will check the PTT before administering the heparin. I will need to gently aspirate when I give the heparin. Here are the options. Option A, I will need to gently aspirate when I give the heparin. The correct answer is option A, I will need to gently aspirate when I give the heparin. Correct answer, I will need to gently aspirate when I give the heparin. Question 56. The nurse is caring for a client with beta thalassemia major. Which therapy is used to treat beta thalassemia major? Roman 4 fluids, frequent blood transfusions, oxygen therapy, iron therapy. Here are the options. Option A, frequent blood transfusions. The correct answer is option A, frequent blood transfusions. Correct answer, frequent blood transfusions. Question 57. The client with a recent liver transplant asks the nurse how long he will have to take an immunosuppressant. Which response is correct? 1 year, 5 years, 10 years, life. Here are the options. Option A, life. The correct answer is option A, life. Correct answer, life. Question 58. The nurse is caring for a patient following a thyroidectomy. Which of the following is an early symptom of hypocalcemia? Positive CH Fostex sign 3+, deep tendon reflexes, numbness or tingling of the toes and extremities, prolonged ST and QT intervals. Here are the options. Option A, numbness or tingling of the toes and extremities. The correct answer is option A, numbness or tingling of the toes and extremities. Correct answer, numbness or tingling of the toes and extremities. Question 59. Which of the following is the best indication of resolution of a paralytic ileus? Passage of stool, eructation, presence of bowel sounds, decreasing abdominal girth. Here are the options. Option A, passage of stool. The correct answer is option A, passage of stool. Correct answer, passage of stool. Question 60. The nurse is caring for a client with a diagnosis of cirrhosis who is experiencing pruritus. Which of the following is an appropriate nursing intervention? Suggesting that the client take warm showers twice daily, applying a lotion containing menthol or camphor to the skin after bathing, applying powder to the client's skin, placing warm compresses on the affected areas. Here are the options. Option A, applying a lotion containing menthol or camphor to the skin after bathing. The correct answer is option A, Applying a lotion containing menthol or camphor to the skin after bathing. Correct answer. Applying a lotion containing menthol or camphor to the skin after bathing. Question 61. The nurse is caring for a client with a recent laparoscopic hemicolectomy. Which finding should be reported to the physician? Sluggish bowel sounds, pain, and tenderness at the umbilicus passage of small amount of liquid stool, increasing abdominal girth. Here are the options. Option A. Increasing abdominal girth. The correct answer is option A. Increasing abdominal girth. Correct answer. Increasing abdominal girth. Question 62. The client presents to the emergency room with a hyphema. Which action by the nurse would be appropriate? Elevate the head of the bed and apply ice to the eye. Place the client in a supine position and apply heat to the knee. Insert a Foley catheter and measure the intake and output. Perform a vaginal exam and check for discharge. Here are the options. Option A. Elevate the head of the bed and apply ice to the eye. The correct answer is option A. Elevate the head of the bed and apply ice to the eye. Correct answer. Elevate the head of the bed and apply ice to the eye. Question 63. The patient is prescribed metronidazole flagyl for adjunct treatment for a duodenal ulcer. When teaching about this medication, the nurse would include, this medication should be taken only until you begin to feel better. This medication should be taken on an empty stomach to increase absorption. While taking this medication, you do not have to be concerned about being in the sun. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. Here are the options. Option A. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. The correct answer is option A. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. Correct answer. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. Question 64. The nurse is evaluating the client's pulmonary artery pressure (PAP). The nurse is aware that PAP evaluates pressure in the left ventricle systolic, diastolic, and mean pressure in the pulmonary artery, pressure in the pulmonary veins, pressure in the right ventricle. Here are the options. Option A. Systolic, diastolic, and mean pressure in the pulmonary artery. The correct answer is option A. Systolic, diastolic, and mean pressure in the pulmonary artery. Correct answer. Systolic, diastolic, and mean pressure in the pulmonary artery. Question 65. When assessing the client's blood pressure, the nurse should use a cuff with a width that is blank % of the circumference of the extremity. Fill in the blank. 40,302,010. Here are the options. Option A. 40. The correct answer is option A. 40. Correct answer, 40. Question 66. A client is admitted to the hospital in chronic renal failure. A low-protein diet is ordered. The rationale for a low-protein diet is that a low-protein diet helps reduce blood urea nitrogen and other wastes excreted by the kidneys. A low-protein diet increases the sodium and potassium levels. A low-protein diet increases albumin production. A low-protein diet increases the calcium and phosphorus levels. Here are the options. Option A. A low-protein diet helps reduce blood urea nitrogen and other waste excreted by the kidneys. The correct answer is option A. A low-protein diet helps reduce blood urea nitrogen and other waste excreted by the kidneys. Correct answer. A low-protein diet helps reduce blood urea nitrogen and other waste excreted by the kidneys. Question 67. Before administering eye drops, the nurse should recognize that it is essential to consider which of the following. The eye should be cleansed with warm water to remove any exudate before instilling the eye drops. The patient will be more comfortable if allowed to instill his own eye drops. Eye drops should be instilled with the patient looking down. Eye drops should always be warmed before instilling in the patient's eyes. Here are the options. Option A. The eye should be cleansed with warm water to remove any exudate before instilling the eye drops. The correct answer is option A. The eye should be cleansed with warm water to remove any exudate before instilling the eye drops. Correct answer. The eye should be cleansed with warm water to remove any exudate before instilling the eye drops. Question 68. A client with cirrhosis is receiving Cephilac lactulose. The nurse is aware that Cephilac is given to lower blood glucose, uric acid, ammonia, creatinine. Here are the options. Option A. Ammonia. The correct answer is option A. Ammonia. Correct answer, ammonia. Question 69. The physician prescribes captopril 25 mg PO/bid for the client with hypertension. Which of the following adverse reactions can occur with administration of capoten? Tinnitus, persistent cough, muscle weakness, diarrhea. Here are the options. Option A. Persistent cough. The correct answer is option A. Persistent cough. Correct answer, persistent cough. Question 70. The home health nurse is planning for the day's visits. Which client should be seen first? The client with renal insufficiency, the client with Alzheimer's disease, the client with diabetes who has a decubitus ulcer, the client with multiple sclerosis who is being treated with Roman 4 cortisone. Here are the options. Option A. The client with multiple sclerosis who is being treated with Roman 4 cortisone. The correct answer is option A. The client with multiple sclerosis who is being treated with Roman 4 cortisone. Correct answer. The client with multiple sclerosis who is being treated with Roman 4 cortisone. Question 71. In planning care for the patient with ulcerative colitis, the nurse identifies which nursing diagnosis as a priority. Anxiety, impaired skin integrity, fluid volume deficit, nutrition altered, less than body requirements. Here are the options. Option A. Fluid volume deficit. The correct answer is option A. Fluid volume deficit. Correct answer, fluid volume deficit. Question 72. A nurse indicates that she is licensed in her new state of residence even though reciprocity has not been granted. The nurse's action can result in a charge of fraud, tort, malpractice, negligence. Here are the options. Option A. Fraud. The correct answer is option A. Fraud. Correct answer, fraud. Question 73. Which complaint is frequently expressed by a client with macular degeneration? Problems with activities requiring focused vision, such as sewing, severe eye and face pain accompanied by nausea and vomiting, seeing halos around lights, veil-like loss of vision. Here are the options. Option A. Problems with activities requiring focused vision such as sewing. The correct answer is option A. Problems with activities requiring focused vision such as sewing. Correct answer. Problems with activities requiring focused vision such as sewing. Question 74. When assessing deep tendon reflexes, the nurse grades the client's patellar reflex as a 3+. This reading indicates that the assessed reflex is stronger than normal hypoactive, normal hyperactive. Here are the options. Option A, stronger than normal. The correct answer is option A, stronger than normal. Correct answer, stronger than normal. Question 75. A client with a femoral popliteal bypass graft is assigned to a semi-private room. The most suitable roomite for this client is the client with hypothyroidism, diabetic ulcers, gastroenteritis, bacterial pneumonia. Here are the options. Option A, hypothyroidism. The correct answer is option A, hypothyroidism. Correct answer, hypothyroidism. Question 76. The client arrives in the emergency department after a motor vehicle accident. Nursing assessment findings include BP 68/34, pulse rate 130, and respirations 18. Which is the client's most appropriate priority nursing diagnosis? Alteration in cerebral tissue perfusion, fluid volume deficit, ineffective airway clearance, alteration in sensory perception. Here are the options. Option A, fluid volume deficit. The correct answer is option A, fluid volume deficit. Correct answer, fluid volume deficit. Question 77. The nurse identifies ventricular tachycardia on the cardiac monitor. The patient had a pulse rate of 160 with a regular rhythm. The nurse should give priority to administering atropine sulfate, requesting a stat potassium level, administering amiodarone, defibrillating at 360 joules. Here are the options. Option A, deministering amiodarone. The correct answer is option A, deministering amiodarone. Correct answer, deministering amiodarone. Question 78. The nurse is discharging a client with a prescription of eye drops. Which observation by the nurse would indicate a need for further client teaching? Shaking of the suspension to mix the medication, administering a second eye drop medication immediately after the first one was instilled, washing the hands before and after the administration of the drops, holding the lower lid down without pressing the eyeball to instill the drops. Here are the options. Option A, administering a second eye drop medication immediately after the first one was instilled. The correct answer is option A, administering a second eye drop medication immediately after the first one was instilled. Correct answer, administering a second eye drop medication immediately after the first one was instilled. Question 79. The physician has prescribed Novolog as part insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the onset of the insulin occurs? I will make sure I eat breakfast within 10 minutes of taking my insulin. I will need to carry candy or some form of sugar with me all the time. I will eat a snack around 3 o'clock each afternoon. I can save my dessert from supper for a bedtime snack. Here are the options. Option A, I will make sure I eat breakfast within 10 minutes of taking my insulin. The correct answer is option A, I will make sure I eat breakfast within 10 minutes of taking my insulin. Correct answer. I will make sure I eat breakfast within 10 minutes of taking my insulin. Question 80. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is measuring the urinary output, checking the vital signs, encouraging increased fluid intake, weighing the client. Here are the options. Option A, checking the vital signs. The correct answer is option A, checking the vital signs. Correct answer, checking the vital signs. Question 81. The nurse is teaching a client with peritoneal dialysis how to manage exchanges at home. The nurse should tell the client to notify the doctor immediately if the dialysate returns become cloudy in appearance. The return of the dialysate is slower than usual. A tugging sensation is noted as the dialysate drains. A feeling of fullness is felt when the dialysate is instilled. Here are the options. Option A. The dialysate returns become cloudy in appearance. Indicates infection and impending peritonitis. The correct answer is option A. The dialysate returns become cloudy in appearance. Indicates infection and impending peritonitis. Correct answer. The dialysate returns become cloudy in appearance. Indicates infection and impending peritonitis. Question 82. The nurse is caring for a client with diabetes mellitus. Which instruction should be given to the client? Tell the client to avoid stairs. Tell the client to decrease her intake of sodium. Instruct the client to weigh daily. Tell the client to report numbness and tingling in her feet and toes. Here are the options. Option A. Tell the client to report numbness and tingling in her feet and toes. Diabetic neuropathy. The correct answer is option A. Tell the client to report numbness and tingling in her feet and toes. Diabetic neuropathy. Correct answer. Tell the client to report numbness and tingling in her feet and toes. Diabetic neuropathy. Question 83. A client with myasthenia gravis is admitted in a cholinergic crisis. Signs of cholinergic crisis include decreased blood pressure and constricted pupils, increased heart rate and increased respirations and increased blood pressure, anoxia, and absence of the cough reflex. Here are the options. Option A. Decreased blood pressure and constricted pupils over medication with anticholinesterase inhibitors. The correct answer is option A. Decreased blood pressure and constricted pupils over medication with anticholinesterase inhibitors. Correct answer. Decreased blood pressure and constricted pupils over medication with anticholinesterase inhibitors. Question 84. The nurse caring for a client with a head injury would recognize which assessment finding as the most indicative of NCLEX ICP? Vomiting, headache, dizziness, papilledema. Here are the options. Option A. Papilledema causes the part of the optic nerve inside the eye to swell, vision, headache, vomiting. The correct answer is option A. Papilledema causes the part of the optic nerve inside the eye to swell, vision, headache, vomiting. Correct answer. Papilledema causes the part of the optic nerve inside the eye to swell, vision, headache, vomiting. Question 85. On the second postoperative day after subtotal thyroidectomy, the client tells the nurse, "I feel numbness and my face is twitching." What is the nurse's best initial action? Offer mouth care. Loosen the neck dressing. Notify the physician. Document the finding is the only action. Here are the options. Option A. Notify the physician. Hypocalcemia and symptoms of tetany. The correct answer is option A. Notify the physician. Hypocalcemia and symptoms of tetany. Correct answer. Notify the physician. Hypocalcemia and symptoms of tetany. Question 86. Which statement is true regarding a patient with a Sangstaken-Blakemore tube? The smaller balloon will provide direct pressure to control bleeding from the esophagus. The tube has 4 lumens, one of which drains esophageal secretions. The esophageal balloon should be inflated to a pressure between 30-35 mmHg. Scissors should be kept at the patient's bedside. Here are the options. Option A. Scissors should be kept at the patient's bedside. To deflate balloons and remove the tube rapidly. The correct answer is option A. Scissors should be kept at the patient's bedside. To deflate balloons and remove the tube rapidly. Correct answer. Scissors should be kept at the patient's bedside. To deflate balloons and remove the tube rapidly. Question 87. The nurse is assessing a trauma client in the emergency room when she notes a penetrating abdominal wound with exposed viscera. The nurse should apply a clean dressing to protect the wound. Cover the exposed viscera with a sterile saline gauze. Gently replace the abdominal contents. Cover the area with a petroleum gauze. Here are the options. Option A. Over the exposed viscera with a sterile saline gauze. The correct answer is option A. Over the exposed viscera with a sterile saline gauze. Correct answer. Over the exposed viscera with a sterile saline gauze. Question 88. Which medication should be avoided by the client with acute pancreatitis? Demerol, meperidine, pepsid, famotidine, Zantac, ranitidine, duramorph, morphine sulfate. Here are the options. Option A. Uramorph morphine sulfate causes spasms of the sphincter of Oddi. The correct answer is option A. Uramorph morphine sulfate causes spasms of the sphincter of Oddi. Correct answer. Uramorph morphine sulfate causes spasms of the sphincter of Oddi. Question 89. The nurse is changing the ties of the client with a tracheostomy. The safest method of changing the tracheostomy ties is to apply the new tie before removing the old one. Have a helper present in case assistance is needed. Hold the tracheostomy tie with the non-dominant hand while removing the old tie. Ask the client to hold the tracheostomy in place as the ties are changed. Here are the options. Option A. Apply the new tie before removing the old one. The correct answer is option A. Apply the new tie before removing the old one. Correct answer. Apply the new tie before removing the old one. Question 90. A client is to receive dilantin phenytoin via a nasogastric NG tube. When giving the medication, the nurse should flush the NG tube with 2-4 ml of water before giving the medication. Administer the medication, flush with 5 ml of water, and clamp the NG tube. Flush the NG tube with 5 ml of normal saline and administer the medication. Flush the NG tube with 2-4 Oz of water before and after giving the medication. Here are the options. Option A. Flush the NG tube with 2-4 Oz of water before and after giving the medication. The correct answer is option A. Flush the NG tube with 2-4 Oz of water before and after giving the medication. Correct answer. Flush the NG tube with 2-4 Oz of water before and after giving the medication. Question 91. A client having a colonoscopy is medicated with versed-midazolam. The nurse recognizes that the client will be able to remember the procedure within 2-3 hours, will not be able to remember having the procedure done, will be able to remember the procedure within 2-3 days, will not be able to remember what occurred before the procedure. Here are the options. Option A. Will not be able to remember having the procedure done versus produces conscious sedation. The correct answer is option A. Will not be able to remember having the procedure done versus produces conscious sedation. Correct answer. Will not be able to remember having the procedure done versus produces conscious sedation. Question 92. The nurse is planning care for a client with adrenal insufficiency. The nurse should give priority to monitoring the client for signs of dehydration, promoting sleep and rest, providing high-calorie snacks, promoting a healthy body image. Here are the options. Option A. Monitoring the client for signs of dehydration, frequently suffers from fluid volume deficit and acidosis. The correct answer is option A. Monitoring the client for signs of dehydration, frequently suffers from fluid volume deficit and acidosis. Correct answer. Monitoring the client for signs of dehydration, frequently suffers from fluid volume deficit and acidosis. Question 93. The nurse is assessing a client who had a colon resection 2 days ago. The client states, "I feel like my stitches have burst loose." Upon further assessment, dehiscence of the wound is noted. Which action should the nurse take? Immediately place the client in the prone position. Apply a sterile, saline moistened dressing to the wound. Administer atropine to decrease abdominal secretions. Wrap the abdomen with an AC bandage. Here are the options. Option A. Apply a sterile, saline moistened dressing to the wound. The correct answer is option A. Apply a sterile, saline moistened dressing to the wound. Correct answer. Apply a sterile, saline moistened dressing to the wound. Question 94. The nurse is caring for a client admitted to the emergency room after a fall. X-rays reveal that the client has several fractured bones in the foot. Which treatment should the nurse anticipate for the fractured foot? Application of a walking boot, stabilization with a cast, surgery with Kirschner wire implantation, application of Spica cast. Here are the options. Option A. Stabilization with a cast. The correct answer is option A. Stabilization with a cast. Correct answer, stabilization with a cast. Question 95. The nurse is preparing a client with gastroesophageal reflux disease GERD for discharge. The nurse should tell the client to eat a small snack before bedtime, sleep on his right side, avoid carbonated beverages, increase his intake of citrus fruits. Here are the options. Option A. Avoid carbonated beverages. The correct answer is option A. Avoid carbonated beverages. Correct answer. Avoid carbonated beverages. Question 96. The nurse is performing discharge teaching on a client with ulcerative colitis who has been placed on a low-residue diet. Which food would need to be eliminated from this client's diet? Roasted chicken noodles, cooked broccoli, roast beef. Here are the options. Option A. Cooked broccoli. The correct answer is option A. Cooked broccoli. Correct answer. Cooked broccoli. Question 97. While caring for a client with cervical cancer, the nurse notes that the radioactive implant is lying in the bed. The nurse should Place the implant in a biohazard bag and return it to the lab. Give the client a pair of gloves and ask her to reinsert the implant. Use tongs to pick up the implant and return it to a lead-lined container. Discard the implant in the commode and double flush. Here are the options. Option A. Use tongs to pick up the implant and return it to a lead-lined container. The correct answer is option A. Use tongs to pick up the implant and return it to a lead-lined container. Correct answer. Use tongs to pick up the implant and return it to a lead-lined container. Question 98. A client with Parkinson's disease is scheduled for stereotactic surgery. Which finding indicates that the surgery had its intended effect? The client no longer has intractable tremors. The client has sufficient production of dopamine. The client no longer requires any medication. The client will have increased production of serotonin. Here are the options. Option A. The client no longer has intractable tremors. The correct answer is option A. The client no longer has intractable tremors. Correct answer. The client no longer has intractable tremors. Question 99. The physician has ordered a homocysteine blood level on a client. The nurse recognizes that the results will be increased in a client with a deficiency in which of the following? Vitamin B12, vitamin C, vitamin E. Here are the options. Option A. Vitamin B12 increased when a client has B12 deficiency. The correct answer is option A. Vitamin B12 increased when a client has B12 deficiency. Correct answer. Vitamin B12 increased when a client has B12 deficiency. Question 100. Which obstetrical client is most likely to have an infant with respiratory distress syndrome? A 28-year-old with a history of alcohol use during the pregnancy, a 24-year-old with a history of diabetes mellitus, a 30-year-old with a history of smoking during the pregnancy, a 32-year-old with a history of pregnancy-induced hypertension. Here are the options. Option A. A 24-year-old with a history of diabetes mellitus. The correct answer is option A. A 24-year-old with a history of diabetes mellitus. Correct answer. A 24-year-old with a history of diabetes mellitus. Question 101. A client with a C4 spinal cord injury has been placed in traction with cervical tongs. Nursing care should include releasing the traction for 5 minutes each shift, loosening the pins if the client complains of headache, elevating the head of the bed 90 degrees, performing sterile pin care as ordered. Here are the options. Option A. Performing sterile pin care is ordered. The correct answer is option A. Performing sterile pin care is ordered. Correct answer. Performing sterile pin care is ordered. Question 102. The nurse has been teaching the role of diet in regulating blood pressure to a client with hypertension. Which meal selection indicates the client understands his new diet? Cornflakes, whole milk, banana and coffee, scrambled eggs, bacon, toast and coffee, oatmeal, apple juice, dry toast and coffee, pancakes, ham, tomato juice and coffee. Here are the options. Option A. Oatmeal, apple juice, dry toast and coffee. The correct answer is option A. Oatmeal, apple juice, dry toast and coffee. Correct answer. Oatmeal, apple juice, dry toast and coffee. Question 103. The nurse is caring for a child in a plaster of Paris hip spica cast. To facilitate drying, the nurse should use a small handheld hair dryer set on medium heat. Place a small heater near the child's bed. Turn the child at least every 2 hours. Allow one side to dry before changing positions. Here are the options. Option A. Turn the child at least every 2 hours. The correct answer is option A. Turn the child at least every 2 hours. Correct answer. Turn the child at least every 2 hours. Question 104. A client is admitted with kidney disease. Which type of intravenous fluid is likely to be ordered for this client? Hypertonic, isotonic, colloid, hypotonic. Here are the options. Option A. Isotonic solutions such as 0.9% sodium chloride and lactated ringers. The correct answer is option A. Isotonic solutions such as 0.9% sodium chloride and lactated ringers. Correct answer. Isotonic solutions such as 0.9% sodium chloride and lactated ringers. Question 105. Which of the following statements is true regarding management of the client with multiple sclerosis? Taking a hot bath will decrease stiffness and spasticity. A schedule of strenuous exercise will improve muscle strength. Rest periods should be scheduled throughout the day. Visual disturbances can be corrected with prescription glasses. Here are the options. Option A. Rest periods should be scheduled throughout the day. The correct answer is option A. Rest periods should be scheduled throughout the day. Correct answer. Rest periods should be scheduled throughout the day. Question 106. The nurse is preparing to administer regular insulin by continuous Roman 4 infusion to a client with diabetic ketoacidosis. The nurse should mix the insulin with dextrose 5% in water. Flush the Roman 4 tubing with the insulin solution and discard the first 50 ml. Avoid using a pump or controller with the infusion. Mix the insulin with Ringer's lactate. Here are the options. Option A. Flush the Roman 4 tubing with the insulin solution and discard the first 50 ml. Insulin molecules adhere to glass and plastic. The correct answer is option A. Flush the Roman 4 tubing with the insulin solution and discard the first 50 ml. Insulin molecules adhere to glass and plastic. Correct answer. Flush the Roman 4 tubing with the insulin solution and discard the first 50 ml. Insulin molecules adhere to glass and plastic. Question 107. The nurse is caring for a client with possible cervical cancer. What clinical data would the nurse most likely find in the client's history? Postcoital vaginal bleeding, nausea and vomiting, foul-smelling vaginal discharge, elevated temperature levels. Here are the options. Option A. Postcoital vaginal bleeding. Spotting is a common symptom of cervical cancer. The correct answer is option A. Postcoital vaginal bleeding. Spotting is a common symptom of cervical cancer. Correct answer. Postcoital vaginal bleeding. Spotting is a common symptom of cervical cancer. Question 108. The nurse is caring for a client with amyotrophic lateral sclerosis ALS, Lou Gehrig's disease. The nurse should give priority to assessing the client's respiratory status, providing an alternate means of communication, referring the client and family to community support groups, instituting a routine of active range of motion exercises. Here are the options. Option A. Assessing the client's respiratory status. The correct answer is option A. Assessing the client's respiratory status. Correct answer. Assessing the client's respiratory status. Question 109. The physician has prescribed nitroglycerin sublingual tablets as needed for client with angina. The nurse should tell the client to take the medication after engaging in strenuous activity every 4 hours to prevent chest pain, as soon as he notices signs of chest pain at bedtime to prevent nocturnal angina. Here are the options. Option A. As soon as he notices signs of chest pain. The correct answer is option A. As soon as he notices signs of chest pain. Correct answer. As soon as he notices signs of chest pain. Question 110. A client is admitted to the emergency department with a loss of consciousness with unknown etiology. The nurse expects to perform which laboratory test to assist in determining etiology? Total cholesterol alkaline phosphatase serum glucose urinalysis. Here are the options. Option A. Serum glucosis in determining the cause of the loss of consciousness. The correct answer is option A. Serum glucosis in determining the cause of the loss of consciousness. Correct answer. Serum glucosis in determining the cause of the loss of consciousness. Question 111. The home health nurse is visiting a 30-year-old with sickle cell disease. Assessment findings include splenomegaly. What information obtained on the visit would cause the most concern? The client eats fast food daily for lunch, drinks a beer occasionally, sometimes feels fatigued, works as a furniture mover. Here are the options. Option A. Works as a furniture mover. The correct answer is option A. Works as a furniture mover. Correct answer. Works as a furniture mover. Question 112. The nurse is caring for a client with a head injury who has an intracranial pressure monitor in place. Assessment reveals an ICP reading of 66. What is the nurse's best action? Notify the physician, record the reading as the only action. Turn the client and recheck the reading. Place the client supine. Here are the options. Option A. Notify the physician normal ICP is 10-20. A reading of 66 is high. The correct answer is option A. Notify the physician normal ICP is 10-20. A reading of 66 is high. Correct answer. Notify the physician normal ICP is 10-20. A reading of 66 is high. Question 113. The nurse is completing the preoperative checklist on a client scheduled for surgery and finds that the consent form has been signed, but the client is unclear about the surgery and possible complications. Which is the most appropriate action? Call the surgeon and ask him to come see the client to clarify the information. Explain the procedure and complications to the client. Check in the physician's progress notes to see if understanding has been documented. Check with the client's family to see if they understand the procedure fully. Here are the options. Option A. Call the surgeon and ask him to come see the client to clarify the information. The correct answer is option A. Call the surgeon and ask him to come see the client to clarify the information. Correct answer. Call the surgeon and ask him to come see the client to clarify the information. Question 114. 4 clients are to receive medication. Which client should receive medication first? A client with an apical pulse of 72 receiving Lanix and Digix and PO daily. A client with abdominal surgery receiving Phenergan promethazine IM every 4 hours PRN for nausea and vomiting. A client with labored respirations receiving a stat dose of Roman 4 Lasix furosemide. A client with pneumonia receiving polycillin ampicillin IV every 6 hours. Here are the options. Option A. A client with labored respirations receiving a stat dose of Roman 4 Lasix furosemide. The correct answer is option A. A client with labored respirations receiving a stat dose of Roman 4 Lasix furosemide. Correct answer. A client with labored respirations receiving a stat dose of Roman 4 Lasix furosemide. Question 115. The nurse is planning the diet of a client who is recovering from acute pancreatitis. The nurse should select foods that are high in carbohydrate and protein, low in sodium, but high fat, high in protein, and sodium, low in fat and low protein. Here are the options. Option A. Low in fat and low protein. The correct answer is option A. Low in fat and low protein. Correct answer. Low in fat and low protein. Question 116. A client with congestive heart failure has been receiving Digix and Lexixin. Which finding indicates that the medication is having a desired effect? Increased urinary output, stabilized weight, improved appetite, increased pedal edema. Here are the options. Option A. Increased urinary output. Lanixin slows and strengthens the contraction of the heart. The correct answer is option A. Increased urinary output. Lanixin slows and strengthens the contraction of the heart. Correct answer. Increased urinary output. Lanixin slows and strengthens the contraction of the heart. Question 117. The physician has ordered 2 units of whole blood for a client following surgery. To provide for client's safety, the nurse should obtain a signed permit for each unit of blood. Use a new administration set for each unit transfused. Administer the blood using a Y connector. Check the blood type and RH factor 3 times before initiating the transfusion. Here are the options. Option A. Check the blood type and RH factor 3 times before initiating the transfusion. The correct answer is option A. Check the blood type and RH factor 3 times before initiating the transfusion. Correct answer. Check the blood type and RH factor 3 times before initiating the transfusion. Question 118. During the change of shift report, a nurse writes in her notes that she suspects illegal drug use by a client assigned to her care. During the shift, the notes are found by the client's daughter. The nurse could be sued for libel, slander, malpractice, negligence. Here are the options. Option A. Libel. The correct answer is option A. Libel. Correct answer, libel. Question 119. The registered nurse is making shift assignments. Which client should be assigned to the licensed practical nurse LPN? A client who is a diabetic with a foot ulcer. A client with a deep vein thrombosis receiving intravenous heparin. A client being weaned from a tracheostomy. A post-operative cholecystectomy with a T-tube. Here are the options. Option A. A client who is a diabetic with a foot ulcer. The correct answer is option A. A client who is a diabetic with a foot ulcer. Correct answer. A client who is a diabetic with a foot ulcer. Question 120. A client is admitted with sickle cell crises and sequestration. Upon assessing the client, the nurse would expect to find decreased blood pressure, moist mucous membranes, decreased respirations, increased blood pressure. Here are the options. Option A. Decreased blood pressure will have signs of hypovolemia, including decreased blood pressure. The correct answer is option A. Decreased blood pressure will have signs of hypovolemia, including decreased blood pressure. Correct answer. Decreased blood pressure will have signs of hypovolemia, including decreased blood pressure. Question 121. The nurse knows that a client with right-sided hemiplegia understands teaching regarding ambulation with a cane if she states, "I will hold the cane in my right hand. I will advance my cane in my right leg at the same time. I will be able to walk only by using a walker. I will hold the cane in my left hand." Here are the options. Option A. I will hold the cane in my left hand. The correct answer is option A. I will hold the cane in my left hand. Correct answer. I will hold the cane in my left hand. Question 122. The nurse is conducting a physical assessment on a client with mild anemia. Which of the following would the nurse expect to observe? Heart murmur, increased respiratory rate, activity intolerance, frequent respiratory infections. Here are the options. Option A. Increased respiratory rate. The correct answer is option A. Increased respiratory rate. Correct answer. Increased respiratory rate. Question 123. A client with angina is experiencing migraine headaches. The physician has prescribed sumatriptan 6-8 Imitrex. Which nursing action is most appropriate? Call the physician to question the prescription order. Try to obtain samples for the client to take home. Perform discharge teaching regarding this drug. Consult social services for financial assistance with obtaining the drug. Here are the options. Option A. Call the physician to question the prescription order. Imitrex results in cranial vasoconstriction to reduce pain, but it can also cause vasoconstrictory effects systemically contraindicated in PTS with angina. The correct answer is option A. Call the physician to question the prescription order. Imitrex results in cranial vasoconstriction to reduce pain, but it can also cause vasoconstrictory effects systemically contraindicated in PTS with angina. Correct answer. Call the physician to question the prescription order. Imitrex results in cranial vasoconstriction to reduce pain, but it can also cause vasoconstrictory effects systemically contraindicated in PTS with angina. Question 124. The nurse is assessing a client hospitalized with a duodenal ulcer. Which finding should be reported to the doctor immediately? BP 82/60, pulse 120, pulse 68, respirations 24, BP 110/88, pulse 56, pulse 82, respiration 16. Here are the options. Option A. BP 82/60. Pulse 120, decreased BP and increased pulse are associated with bleeding and shock. The correct answer is option A. BP 82/60. Pulse 120, decreased BP and increased pulse are associated with bleeding and shock. Correct answer. BP 82/60. Pulse 120, decreased BP and increased pulse are associated with bleeding and shock. Question 125. Which statement made by the family member caring for the client with the percutaneous gastrostomy tube indicates understanding of the nurse's teaching? I must flush the tube with water after feedings and clamp the tube. I must check placement 4 times per day. I will report to the doctor any signs of indigestion. If my father is unable to swallow, I will discontinue the feeding and call the clinic. Here are the options. Option A. I must flush the tube with water after feedings and clamp the tube. The correct answer is option A. I must flush the tube with water after feedings and clamp the tube. Correct answer. I must flush the tube with water after feedings and clamp the tube. Question 126. The nurse is caring for a client following the reimplantation of the thumb and index finger. Which finding should be reported to the physician immediately? Temperature of 100 degrees F, coolness and discoloration of the digits, complaints of pain, difficulty moving the digits. Here are the options. Option A. Coolness and discoloration of the digits. The correct answer is option A. Coolness and discoloration of the digits. Correct answer. Coolness and discoloration of the digits. Question 127. The nurse is caring for a client with full thickness burns to the lower half of the torso and lower extremities. During the emergent phase of injury, the primary nursing diagnosis would focus on imbalanced nutrition, less than body requirements related to hypermetabolic state, risk for infection related to altered skin integrity, risk for fluid volume imbalance related to intracompartmental fluid shift, acute pain related to burn injury. Here are the options. Option A. Risk for fluid volume imbalance related to intracompartmental fluid shift, emergent phase. The correct answer is option A. Risk for fluid volume imbalance related to intracompartmental fluid shift, emergent phase. Correct answer. Risk for fluid volume imbalance related to intracompartmental fluid shift, emergent phase. Question 128. A client with rheumatoid arthritis is receiving injections of meocresine gold sodium thiomalate. Before administering the client's medication, the nurse should check the lab work, administer an antiemetic, obtain the blood pressure, administer a sedative. Here are the options. Option A. Check the lab work. Gold salts are toxic to the kidneys and the bone marrow. The correct answer is option A. Check the lab work. Gold salts are toxic to the kidneys and the bone marrow. Correct answer. Check the lab work. Gold salts are toxic to the kidneys and the bone marrow. Question 129. Which finding is associated with secondary syphilis? Painless, papular lesions on the perineum, fingers, and eyelids, absence of lesions, deep asymmetrical granulomatous lesions, well-defined generalized lesions on the palms, soles, and perineum. Here are the options. Option A. Well-defined generalized lesions on the palms, soles, and perineum. The correct answer is option A. Well-defined generalized lesions on the palms, soles, and perineum. Correct answer. Well-defined generalized lesions on the palms, soles, and perineum. Question 130. The nurse is caring for a client with Lyme's disease. The nurse should carefully monitor the client for signs of neurological complications, which include complaints of a drawing sensation and paralysis on one side of the face, presence of an unsteady gait, intention tremor, and facial weakness, complaints of excruciating facial pain brought on by talking, smiling, or eating, presence of fatigue when talking, dysphagia, and involuntary facial twitching. Here are the options. Option A. Complaints of a drawing sensation and paralysis on one side of the face. The correct answer is option A. Complaints of a drawing sensation and paralysis on one side of the face. Correct answer. complaints of a drawing sensation and paralysis on one side of the face. Question 131. The client has surgery for removal of a prolectinoma. Which of the following interventions would be appropriate for this client? Place the client in Trendelenburg position for postural drainage. Encourage coughing and deep breathing every 2 hours. Elevate the head of the bed 30 degrees. Encourage the client to gently blow the nose every 2 hours to remove secretions. Here are the options. Option A. Elevate the head of the bed 30 degrees. A prolectinoma is a type of pituitary tumor. 30 degrees decreases the ICP and reduces risk of CSF leaks. The correct answer is option A. Elevate the head of the bed 30 degrees. A prolectinoma is a type of pituitary tumor. 30 degrees decreases the ICP and reduces risk of CSF leaks. Correct answer. Elevate the head of the bed 30 degrees. A prolectinoma is a type of pituitary tumor. 30 degrees decreases the ICP and reduces risk of CSF leaks. Question 132. A client is hospitalized with signs of transplant rejection following a recent renal transplant. Assessment of the client would be expected to reveal a weight loss of 2 pounds in 1 day, a serum creatinine 1.25 mg/dl, urinary output of 50 ml/hr, rising blood pressure. Here are the options. Option A. Rising blood pressure increased BP following renal transplant is an early sign of transplant failure. The correct answer is option A. Rising blood pressure increased BP following renal transplant is an early sign of transplant failure. Correct answer. Rising blood pressure increased BP following renal transplant is an early sign of transplant failure. Question 133. A client with diabetes insipidus is receiving DDAF desmopressin acetate. Which lab finding indicates that the medication is having its intended effect? Blood glucose 92 mg/dl, urine specific gravity 1.0, 2-year white blood count of 7, 500 glycosylated hemoglobin 3.5 mg/dl. Here are the options. Option A. Urine specific gravity 1.20. The correct answer is option A. Urine specific gravity 1.02. Correct answer. Urine specific gravity 1.020. Question 134. The nurse would identify which one of the following assessment findings as a normal response in a craniotomy client postoperatively? A decrease in responsiveness the third post-op day, sluggish pupil reaction the first 24-48 hours, dressing changes 3 to 4 times a day for the first 3 days, temperature range of 98.8 degrees F to 99.6 degrees F the first 2-3 days. Here are the options. Option A. Temperature range of 98.8 degrees F to 99.6 degrees F the first 2-3 days. The correct answer is option A. Temperature range of 98.8 degrees F to 99.6 degrees F the first 2-3 days. Correct answer. Temperature range of 98.8 degrees F to 99.6 degrees F the first 2-3 days. Question 135. The physician has ordered intubation and mechanical ventilation for a client with periods of apnea following a closed head injury. Arterial blood gases reveal a pH of 7.47, PCO2 of 28, and HCO3 of 23. These findings indicate that the client has respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. Here are the options. Option A. Respiratory alkalosis. The correct answer is option A. Respiratory alkalosis. Correct answer. Respiratory alkalosis. Question 136. Which one of the following symptoms is common in the client with duodenal ulcers? Vomiting shortly after eating, epigastric pain following meals, frequent bouts of diarrhea, presence of blood in the stools. Here are the options. Option A. Presence of blood in the stools. The correct answer is option A. Presence of blood in the stools. Correct answer. Presence of blood in the stools. Question 137. A nurse is working in an endoscopy recovery area. Many of the clients are administered midazolam versed to provide conscious sedation. Which medication is important to have available as an antidote for versed? Diazepam, Valium, naloxone, Narcan, Flumezil, Romazicin, Florina, fludrocortisone. Here are the options. Option A. Flumezil, Romazicin. The correct answer is option A. Flumezil, Romazicin. Correct answer. Flumezil, Romazicin. Question 138. The nurse has just received the change of shift report. Which client should the nurse assess first? A client with a supratentorial tumor awaiting surgery, a client admitted with a suspected subdural hematoma, a client recently diagnosed with akinetic seizures, a client transferring to the neurorehabilitation unit. Here are the options. Option A. A client admitted with a suspected subdural hematoma. The correct answer is option A. A client admitted with a suspected subdural hematoma. Correct answer. A client admitted with a suspected subdural hematoma. Question 139. The nurse caring for a client in shock recognizes that the glomerular filtration rate of the kidneys will fail if the client's mean arterial pressure falls below which of the following levels? 14 billion, 12 million, 10,000, 80. Here are the options. Option A. 80. The correct answer is option A. 80. Correct answer. 80. Question 140. The nurse is caring for a patient hospitalized with leukopenia. Which of the following assessments should be reported to the physician immediately? The blood pressure is 110/62. The apical pulse is 90. The temperature has increased from 98.6 degrees F to 99.8 degrees F. The respiratory rate is 24. Here are the options. Option A. The temperature has increased from 98.6 degrees F to 99.8 degrees F. The correct answer is option A. The temperature has increased from 98.6 degrees F to 99.8 degrees F. Correct answer. The temperature has increased from 98.6 degrees F to 99.8 degrees F. Question 141. A client with chronic obstructive pulmonary disease (COPD) is admitted to the respiratory unit. Which physician prescription should the nurse question? O2 at 5L/min by nasal cannula, Solumedrol 125 mg, Rumen 4 push every 6 hours, Ceftriaxone Rosin 1 gram IV daily, Darvocet N100 POPRN pain. Here are the options. Option A. O2 at 5L/min by nasal cannula. The correct answer is option A. O2 at 5L/min by nasal cannula. Correct answer. O2 at 5L/min by nasal cannula. Question 142. A client with cystic fibrosis is taking pancreatic enzymes. The nurse should administer this medication. once per day in the morning 3 times per day with meals once per day at bedtime 4 times per day. Here are the options. Option A. 3 times per day with meals. The correct answer is option A. 3 times per day with meals. Correct answer. 3 times per day with meals. Question 143. The client is admitted for an open reduction internal fixation of a fractured hip. Immediately following surgery, the nurse should give priority to assessing the serum collection Davol drain client's pain nutritional status immobilizer. Here are the options. Option A. Serum collection Davol drain. The correct answer is option A. Serum collection Davol drain. Correct answer. Serum collection Davol drain. Question 144. A client hospitalized with MRSA is placed on contact precautions. Which statement is true regarding precautions for infections spread by contact? The client should be placed in a room with negative pressure. Infection requires close contact, therefore, the door may remain open. Transmission is highly likely, so the client should wear a mask at all times. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. Here are the options. Option A. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. The correct answer is option A. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. Correct answer. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. Question 145. The nurse is caring for a client following a laryngectomy. The nurse can best help the client with communication by providing a pad and pencil, checking on him every 30 minutes, telling him to use the call light, teaching the client simple sign language. Here are the options. Option A. Providing a pad and pencil. The correct answer is option A. Providing a pad and pencil. Correct answer. Providing a pad and pencil. Question 146. The nurse is preparing a client for discharge following the removal of a cataract. The nurse should tell the client to take aspirin for discomfort, avoid bending over to put on his shoes, remove the eye shield before going to sleep, continue showering as usual. Here are the options. Option A. Avoid bending over to put on his shoes. The correct answer is option A. Avoid bending over to put on his shoes. Correct answer. Avoid bending over to put on his shoes. Question 147. A client is admitted to the intensive care unit after falling on an icy sidewalk and striking the right side of the head. An MRI revealed a right-sided epidural hematoma. Which physical force explains the location of the client's injury? Coup, contra coup, deceleration, acceleration. Here are the options. Option A. Coup. A coup type of injury occurs when the brain damage is directly under the site of impact. The correct answer is option A. Coup. A coup type of injury occurs when the brain damage is directly under the site of impact. Correct answer. Coup. A coup type of injury occurs when the brain damage is directly under the site of impact. Question 148. The nurse is assessing the heart sounds of a client with mitral stenosis following a history of rheumatic fever. To hear a mitral murmur, the nurse should place the stethoscope at the third intercostal space right of the sternum, the third intercostal space left of the sternum, the fourth intercostal space beneath the sternum, the fourth intercostal space mid-clavicular line. Here are the options. Option A. The fourth intercostal space midclavicular line. The correct answer is option A. The fourth intercostal space midclavicular line. Correct answer. The fourth intercostal space midclavicular line. Question 149. A client is admitted with symptoms of vertigo and syncope. Diagnostic tests indicate left subclavian artery obstruction. What additional findings would the nurse expect? Memory loss and disorientation, numbness in the face, mouth, and tongue, radial pulse differences over 10 bpm, frontal headache with associated nausea or emesis. Here are the options. Option A. Radial pulse differences over 10 bpm. The correct answer is option A. Radial pulse differences over 10 bpm. Correct answer. Radial pulse differences over 10 bpm. Question 150. An elderly female is admitted with a fractured right femoral neck. Which clinical manifestation would the nurse expect to find? Free movement of the right leg, abduction of the right leg, internal rotation of the right hip, shortening of the right leg. Here are the options. Option A. Shortening of the right leg. The correct answer is option A. Shortening of the right leg. Correct answer. Shortening of the right leg. Question 151. A client hospitalized with renal calculi complains of severe pain in the right flank. In addition to complaints of pain, the nurse can expect to see changes in the client's vital signs that include decreased pulse rate, increased blood pressure, decreased respiratory rate, increased temperature. Here are the options. Option A. Increased blood pressure. The correct answer is option A. Increased blood pressure. Correct answer. Increased blood pressure. Question 152. The nurse is caring for a client hospitalized with a facial stroke. Which diet selection would be suited to the client? Roast beef sandwich, potato chips, pickle spear, iced tea, split pea soup, mashed potatoes, pudding, milk tomato soup, cheese toast, gelatin, coffee, hamburger, baked beans, fruit cup, iced tea. Here are the options. Option A. Split pea soup, mashed potatoes, pudding, milk. The correct answer is option A. Split pea soup, mashed potatoes, pudding, milk. Correct answer. Split pea soup, mashed potatoes, pudding, milk. Question 153. The physician has ordered Zyvox linezolid for a patient diagnosed with vancomycin-resistant enterococcus. Which food should be avoided? Wheat bread, honey, oranges, aged cheese. Here are the options. Option A. Aged cheese. The correct answer is option A. Aged cheese. Correct answer. Aged cheese.